$14,000 in America, $2,800 in Turkey. Same procedure. Here's the math. Before we start, this video is for informational purposes only. We're not medical professionals, and nothing here is medical advice. Always consult a licensed dermatologist or plastic surgeon before any hair restoration procedure. All prices shown are approximate national averages based on publicly available government data and peer-reviewed literature. Individual quotes will vary based on graft count, technique, and clinic. All research in this video comes from ISHRS, CMS, OECD, WHO, Joint Commission International, the National Institutes of Health, and the Republic of Turkey Ministry of Health. In the United States, a standard 2,500 graft FUE hair transplant costs about $14,000 on average. The published range runs from $10,000 at the low end to $20,000 at the high end. That's roughly $4 to $10 per individual graft. Medicare does not cover this procedure. Androgenetic alopecia, the medical term for male and female pattern hair loss, is classified as cosmetic. Most private insurance plans exclude it as well, unless the restoration is reconstructive after burns, trauma, or cancer surgery. The other techniques follow a similar pattern. But the older strip harvest method averages $11,000 in the United States, or about $5 per graft. DHI, direct hair implantation using the Choi pin, averages $18,000 or $9 per graft. DI costs more because it involves single-step implantation and runs longer in the operating room. Now look abroad. In Turkey, the same 2,500 graft FUE package averages $2,800, about $1.10 per graft. That price typically includes the surgery itself, preoperative blood work, PRP therapy, post-operative medications, 2 to 3 hotel nights, and VIP airport transfers. DA packages in Turkey average $3,200. For reference, Mexico averages around $4,200 for FUE. Thailand runs about $4,500. India is the lowest at $1,800, though travel distance becomes a practical factor. The savings versus the US FUE package? $11,200 per procedure. That's 80%. For the identical FUE operation using the same surgical tools. Let's look at why Turkey dominates this market. Turkey received roughly 1.4 million international health tourists in 2023, generating $2.3 billion in revenue. Hair transplantation is one of the top 3 procedure categories, alongside dental and ophthalmology. In that same year, Turkey performed an estimated 550,000 hair transplant procedures, capturing roughly 40% of the global hair restoration medical tourism market. The Turkish Health Tourism Association reports that 1 million international patients traveled specifically for hair transplants in 2022 alone, spending approximately $2 billion. Quality infrastructure is substantial. Turkey has 46 to 47 Joint Commission International accredited facilities, with 29 of them in Istanbul. That places Turkey in the top 3 countries globally for JCI accreditation density. The International Society of Hair Restoration Surgery, ISHRS, has more than 1,200 physician members across 80 countries. About 90 of those members are based in Turkey, which gives the country one of the highest surgeon-to-procedure ratios in the entire sector. Now here's the regulatory story most people don't know. In May 2023, Turkey's Ministry of Health issued the Hair Transplant Units Regulation. It is the world's first procedure-specific legal framework for hair transplantation. Under this regulation, all incisions must be performed by a licensed dermatologist or plastic surgeon. Each facility must hold a ministry-issued hair transplant unit operating license. Non-specialist technicians can prepare and implant grafts, but only a licensed physician can make the incisions. This is actually stricter than the framework in many Western countries, where hair transplantation is often performed without specialty board oversight at the incision stage. Technology adoption in Turkey is advanced. Sapphire FUE blades, sapphire-tipped microchannels that reduce tissue trauma, are the current standard. The DHI Choi implanter pin, which combines channel creation and graft implantation in a single step, is widely available. Motorized and robotic FUE punches in the 0.6 to 0.9 millimeter range are routine, and PRP, platelet-rich plasma, adjunctive therapy is typically included in package pricing. Why are prices so much lower? Several factors combine. Lower labor costs, lower clinical rent, especially outside Istanbul's central business districts, a favorable currency exchange, package pricing efficiency where clinics pre-book hotels and transfers at volume rates, and a high-volume operating model, experienced surgical teams performing dozens of procedures per week drive down unit cost while maintaining skill depth. Istanbul has become the epicenter. Modern medical-grade infrastructure, English-speaking coordinator staff, direct flights from more than 50 countries, and facility density that makes comparison shopping between accredited providers genuinely practical. But before you book a flight, there are things you absolutely need to check. Is the facility ministry licensed under the 2023 regulation? Who is actually making the incisions, a licensed dermatologist or plastic surgeon, or a technician? What is the surgeon's procedure volume and fellowship pathway status? What aftercare and revision policy is included? We've compiled a free checklist, the Medical Tourism Hair Transplant Checklist, covering every question you need to ask, every document to verify, and the common mistakes to avoid. The link is in the description below. Now back to the comparison. Let's talk about the quality question directly. Graft-survival. Peer-reviewed meta-analyses pool FUE follicular unit survival at 86 to 95%, with a pooled average of 89.7% across 21 studies covering 7,362 grafts. That's the published benchmark. What about country-level differences? There are no statistically significant country-level differences when operator experience is matched. ISHRS data shows only a 1% graft yield gap between FUE and FUE-T techniques, and that gap is technique-driven, not geography-driven. Complication rates. A prospective cohort of 158 FUE patients published in BMC Surgery in 2024 reported an overall complication rate below 6%, with more than 90% of follicles surviving at 12 months. A separate retrospective analysis of 820 cases reported 94% patient satisfaction at the 12-month mark. Technology parity. The surgical tools used in Turkey are identical to those used in the United States. Sapphire blades, DHI Choi, pens, motorized punches, PRP adjunctive therapy. The manufacturers, the grades, and the protocols are the same. Accreditation frameworks differ, but both are credible. In the US, surgeons are typically certified by the American Board of Hair Restoration Surgery, ABHRS, plus a state medical board. In Turkey, the framework combines JCI accreditation, Ministry of Health licensing under the 2023 regulation, and ISHRS fellowship pathway membership for the qualified surgeons. Scarring. FUE produces sub-millimeter punctate marks that are typically invisible once hair grows back to 3 to 4 millimeters. FUE produces a linear donor site scar, with folliculitis observed in up to 53% of FUE cases in published reviews, and occasional hypertrophic scarring. Keloid formation is rare in both techniques, but more frequently reported with FUE strip harvesting. Revision rate. Approximately 15 to 20% of patients will need a second session in both regions. This is usually scheduled at 12 months or later, and the driver is individual graft, survival, and donor capacity, not country. So what does the actual patient pathway look like? 5 steps. Step 1. Remote consultation. Most Turkey-based clinics begin with a remote consultation via photo or video submission. The patient sends clear images of the donor area at the back of the scalp, the recipient area, and the existing hairline. A coordinator and supervising physician review the images, estimate the required graft count, and draft a preliminary hairline design. This typically takes 1 to 3 business days. There is no upfront cost at reputable facilities. Step 2. Treatment plan and quote. Once the preliminary plan is agreed, the clinic issues a written treatment plan that includes the recommended technique, FUE, DHI, or a hybrid, the final graft count, the complete package contents, and a fixed all-in price. Some clinics also require a blood work profile and a trichoscopy image before finalizing the plan. Step 3. Travel booking. The patient books flights independently. The clinic arranges the hotel and the VIP airport transfer as part of the package. Typical trip duration is 4 to 5 days, standard itinerary, arrival and consultation on day 0, surgery on day 1, post-operative check on day 2, and departure on day 3 or 4. Step 4. Procedure week. Day 0. In-person consultation, blood work, trichoscopy, hairline design session with the operating surgeon, and informed consent signing. Day 1. Surgery. FUE sessions of 2,500 to 4,000 grafts typically run 6 to 8 hours under local anesthesia. DHI sessions can extend to 8 to 10 hours due to the single-step implantation pattern. Patients remain conscious, can eat lunch, listen to music, or watch media during the procedure. No general anesthesia required. Day 2 or 3. First wash, bandage removal, post-op instruction briefing, and medications provided. Day 3 or 4. Fly home. Most patients can travel 48 to 72 hours post-operatively. Step 5. Recovery and 12-month follow-up. Days 0 through 3, minor forehead swelling and scab formation at the recipient sites. This is normal. Days 10 through 14, scabs shed naturally. Donor site micropunctures fully epithelialize. Normal shampooing resumes. Week 3 through month 3. Transient shock loss of the transplanted shafts. This is expected and does not indicate failure. The follicles remain viable in the scalp. Month 3 through 6, initial regrowth begins. Approximately 30 to 50% of final density is visible by month 6. Month 12, final cosmetic result. 85 to 95% of transplanted follicles have produced mature, cycling hair per peer-reviewed data. Follow-up is typically remote. Photo submissions at months 1, 3, 6, and 12. A local dermatologist manages ongoing medical therapy, finasteride or minoxidil, to preserve native hair around the transplanted area. Approximately 15 to 20% of patients schedule a second session, usually at the 12-month mark or later. The total cost picture? The all-inclusive Turkey FUE package at $2,800 plus flights, typically $600 to $1,200 from the United States, brings the full trip to somewhere between $3,400 and $4,000. That compares to $10,000 to $20,000 at home. So what does the complete picture look like? Prices in Turkey run 70 to 85% lower than in the United States for the same FUE procedure. Graft survival is statistically equivalent, 86 to 95% peer-reviewed, with no significant country-level difference when operator experience is matched. Turkey operates under the world's first procedure-specific legal framework, effective May 2023. Quality infrastructure includes 47 JCI-accredited facilities, ISHRS fellowship pathway surgeons, and ministry-licensed hair transplant units with specialty board oversight at the incision stage. The patient pathway is well established, the surgical technology is equivalent, and complication rates are below 6% in published cohorts. Medical tourism for hair transplantation is a legitimate option when done with careful research, licensed providers, and realistic expectations. You shouldn't have to go broke to feel whole.